Here to keep the chase going, share information, spread unity, preserve our heritage and our culture. We're trying to achieve something that you just can't catch. We're always trying to find a better way, trying to make better dogs. That's what Dixie Doggers Podcast is. That's who we are.
This episode is brought to you by Rankin Ranch 38 Cattle Company. Marc Rankin specializes in Brahma and Brahma Cross cattle in Oglethorpe County, Georgia. You can contact him at 407-832-2077. 407-832-2077. This episode is also brought to you by Phil Wilson of UC Hunting Properties. If you're buying or selling land, farms, or hunting property, these folks know land. You can contact him at 678-791-3483, 678-791-3483, or visit his website down below in the description. Lyme disease is caused by infection with the bacterium Borrelia burgdorferi. The bacteria is transmitted to humans and animals commonly through the bite of infected black-legged ticks. Dogs can display several forms of Lyme disease, but the most common symptoms are lameness, swollen lymph nodes, joint swelling, fatigue, and loss of appetite. In addition, serious kidney complications have been associated with Lyme disease in dogs. Dogs taken to a vet have often been described as they were walking on eggshells. These dogs may have high fevers and begin limping. This can appear suddenly and may shift from one leg to another. Left untreated, it may eventually disappear, only to recur weeks or months later. Nonspecific signs that could indicate Lyme disease is affecting the kidneys can include vomiting, lethargy, anorexia, and weight loss. The kidney form of the disease is less common but often fatal. Only 5 to 10% of infected animals are expected to show clinical signs of Lyme disease. These signs typically occur at the chronic disease stage and as early as 2 to 5 months after infection, although it is possible for signs to develop much later. So how did the ticks become infected? Immature black-legged ticks, larva and nymph life stages, become infected with Borrelia bacteria when they feed on the blood of infected wildlife like rodents. And the ticks stay infected through their next life stages. Infected nymphs or adult female ticks can then spread the bacteria when they take their next blood meal, provided they feed on their animal or human host for at least 24 to 48 hours. This means there's a window of opportunity to remove ticks before they can spread the disease. However, depending on their life stage, ticks may not easily be seen on pets, for although adult ticks are about the size of a sesame seed and even bigger when full of blood, nymphs are smaller. For diagnosis, dogs with lameness, swollen joints, and fever are suspected of having Lyme disease. However, other diseases may also cause these symptoms. There are a few blood tests that may be used for confirmation, such as a general assay. This test detects the presence of antibodies created by exposure to the organism. A test can be falsely negative if the dog is infected but has not yet formed antibodies, or if it never forms enough antibodies to cause a positive reaction. It is recommended to test no earlier than 4 weeks after a tick bite. Some dogs that have been infected for long periods of time may no longer have enough antibodies present to be detected by the test. Therefore, a positive test is meaningful, but a negative is not. A follow-up test, QC6 test, can be done to assess the numerical antibody level as confirmation. Other tests including PCR, polymerase chain reaction, ELISA, enzyme-linked immunosorbent assay, joint fluid analysis, Lyme multiplex assay, and culture can also be done with varying degrees of sensitivity but are often less performed. General blood and urine tests are often done to assess kidney function and look for loss of protein in the urine. If your dog is ill, your veterinarian will consider several factors in arriving at a final diagnosis. The animal's history of tick exposure and the signs they're showing, results of the lab tests to support the Lyme disease diagnosis and rule out the presence of other diseases, and the dog's response to treatment. The standard treatment for dogs sick from Lyme disease is a 30-day course of antibiotics. A longer course may be necessary for some dogs, such as those with Lyme nephritis, which nephritis relating to affecting the kidneys. Antibiotic therapy generally is not recommended for Borrelia-infected dogs without signs of illness, nor is it recommended to prevent Lyme disease in dogs with tick bites. Dogs with Lyme nephritis require additional treatments to manage problems associated with kidney impairment. How can Lyme disease be prevented? General tick control and prevention methods will significantly reduce chances of getting ticks or Lyme disease. Maintaining antibodies against B. burgdorferi through vaccination can further protect your animal. Antibody amounts and duration of vaccine antibodies can vary in individuals. Verifying your animal's antibody response to vaccination helps to assure durable protection. So, a couple questions here that y'all might have, and I'm just going to go through and say the questions that I have here and dive into them. So, what are antibodies? Antibodies are proteins produced by an animal's immune system in response to a foreign substance such as bacteria or viruses. Antibodies recognize and bind to the bacteria and help to eliminate the infection. They're kind of like the bouncers of the immune system. All right, so in the several tests that we discussed, one common one, and that is like really good that a lot of vets use from my research that I've done, is called the Lyme multiplex assay. And so what does that measure? This test quantifies antibodies directed against specific proteins on the surface of this bacteria at the 3 different stages of its life cycle. This profile of the antibodies can indicate whether an animal had been recently infected or chronically infected. It can also be used to monitor protective antibodies after vaccination. Your vet can perform a quick assay in-house that checks for antibodies against only one surface protein for the burgdorferi protein. The in-house assay cannot detect early infection, cannot determine vaccination status, and does not quantify the amount of antibodies your animal is producing. Quantifying these antibodies is an important measure for successful treatment and to confirm your dog being cured from Lyme disease. So, if you have a dog with Lyme disease and your vet doesn't use this assay, maybe bring it up. Maybe that'd be what's good for them. Maybe they've never heard of it. I'm sure most of them have because, like as I said, from my research, it seemed like this was a pretty standard assay to do to kind of gauge how things were going. How can we know treatment was successful? If your animal is successfully treated, antibody levels will decrease by 40% or more after 6 to 8 weeks if it is in the early stage of infection, or after 3 months if the infection is in the chronic stage. Can an animal on treatment get reinfected? Yes, infected ticks can also feed on animals while they're being treated. However, the ongoing treatment will likely prevent reinfection. Can my animal get infected despite being vaccinated? Yes, some animals have been infected despite vaccination. Most common reasons are low or short-lasting vaccine antibodies in the individual animal. It is advisable to monitor the vaccine response annually to ensure the animal develops sufficient antibodies in response to vaccination. Vaccine antibodies can be quantified with the Lyme multiplex assay as early as 2 weeks following vaccination or any time afterwards. Does Lyme disease treatment with antibiotics affect antibody levels? Antibiotic treatment affects the pathogen B. burgdorferi. It does not directly influence antibody titers. However, if the treatment is successful and bacteria are removed from the host, the B cells are not further triggered to produce new antibodies. As a consequence, antibody levels decrease after the treatment. Thus, antibody levels are indicators of treatment success or failure. Can a tick carry other infectious organisms besides B. burgdorferi, Lyme disease, and cause the double infection? Yes, it can. The most common other organism is Anaplasma. Does treatment immediately after a tick bite negate signs of early infection? Not every tick carries the B. burgdorferi. The infection rate of ticks also varies within the geographic region. Therefore, treatment should not be performed based on tick bite alone. If the tick was found on the animal, it can be sent in for the B. burgdorferi or the anaplasma testing. If the tick was infected, early treatment can be considered. However, a tick must feed for at least 24 hours on an animal or human for B. burgdorferi transmission to occur. Only a serological test will confirm whether transmission of B. burgdorferi occurred and the animal was infected. Serological meaning, serum, so liquid. So this is going to be a blood test. Antibodies can be detected in infected animals as early as 3 to 4 weeks after infection. Lyme multiplex testing is recommended at that time. Treatment can be initiated immediately afterwards if antibody levels are positive. Treatment during this early infection phase is generally very effective. Where do clinical signs of Lyme disease occur? Only 5 to 10% of infected animals are expected to show clinical signs of Lyme disease. They typically occur at the chronic disease stage and as early as 2 to 5 months after infection. Clinical signs can also develop much later. All right, so that's all I have for Lyme disease. So as per the usual, kind of watch your animals. So roughly 24 to 48 hours, as long as you checking your dog after you take them hunting or something like that, give them a good look over if you have issues with Lyme disease. It's pretty prevalent here in the Southeast. Typically, prescribed burning is negating a lot of these issues with the high populations of ticks, because if you're going to have a high population of ticks, then you're going to build a bigger reservoir for these Borrelia burgdorferi viruses to transmit between animals and ticks and kind of just do that back and forth. So with some prescribed burning, it kind of negates a lot of those effects. But overall, if you have any more questions, or if y'all need anything you specifically want covered in these Factual Fridays, if I'm not qualified to do it, I can find somebody that is, and I'll make sure to get in touch with them. As always, take care of your dog. If something's up, take them to the vet. Never can know. Thank y'all. Hope y'all enjoyed that episode. Stay tuned for our new episodes every Monday and Wednesday. For questions, advertising, or just to chat, email DixieDoggers01@gmail.com.